Hello, I am Rachel Gregg. I am the medical rep of Energost. I am very pleased to share with you a 5-part informative session on IBS. Consultant and gastroenterologist Dr. Neville Azzopardi has kindly agreed to give us an overview on IBS. Part 1 will tackle pathophysiology. Part 2 will be about associated conditions and signs and symptoms of IBS. Part 3 will be about investigations and also differential diagnosis. Part 4, management, and Part 5, pharmacological therapies. I do hope you find these informative, and thank you for watching.
Hello, my name is Neville Azzopardi. I am a gastroenterologist, and today I have been tasked with giving you a brief overview on irritable bowel syndrome. And what we'll do is basically we'll go into the pathophysiology, the signs, symptoms, and red flag signs in the first part of the presentation. And then the second presentation, what we'll do is we'll touch very briefly on the differential diagnosis and the investigations associated with IBS. And then we'll talk a bit more in depth on the management of IBS, which is the biggest challenge. Irritable bowel syndrome is a challenge. It's a very common condition. It's very common in Malta, possibly because of our Mediterranean diet. Possibly there are other factors as we shall see, but it is an extremely common condition. And patients usually complain of very bad symptoms, which can at times be debilitating. There is a reason why it's called irritable bowel syndrome, because as I said, it's extremely irritating for patients, and it's also irritating for us doctors. It's irritating because when you do all the investigations, everything comes back normal, and because there is no single miraculous drug which cures IBS. It's a question of either managing the symptoms, but actually giving something which cures the symptoms of IBS has so far not been found. And explaining to patients what they need to do to manage their symptoms, something which might take a bit more time, but in the end, it might give rewarding results. But we'll talk more about that later. So let's start off by looking a bit at the pathophysiology of IBS. Truth is, we don't know exactly what happens in IBS. The pathophysiology is not clear. There are many theories, but the exact etiology is still unknown. There is usually more than one of these theories which is at work in every patient, and some patients might have more of a particular theory, while other patients might have one or more of these 5 theories mentioned below. As I said, there are 5 theories. The first theory is that there is an alteration in GI motility, resulting in an alteration in frequency and the regularity of luminal contractions. This might occur following antibiotic use because there is an alteration in the gut microbiota. Change in gut microbiota may also lead to a change in GI motility, and this is then what results in either constipation or loose stools. The second theory is of visceral hypersensitivity, meaning that the gut becomes increasingly sensitive to particular stimuli. What are these stimuli? These are usually related to the brain-gut axis. We know that the gut and the brain are connected. The gut and the brain are connected through the enteric and the central nervous system, and increased stress might lead to a stimulation of the gut through the release of certain hormones, which then might lead to visceral hypersensitivity. The fourth theory is probably the best understood because it's typical from the history, the post-infectious IBS. After a viral or a bacterial gastroenteritis, all the gut microbiota tend to be wiped out by the infective agent, and this then leads to a change in the gut microbiota with a resulting change in gut behavior, with a resulting change in GI motility and visceral hypersensitivity. Fifth theory is related to genetics. We know that monozygotic twins tend to suffer more from IBS symptoms. When one of the two has IBS, probably the other one will have it as well. And the symptoms tend to be very similar as well in these patients. While when we look at all IBS patients, there's a big heterogeneity of symptoms. While other siblings to these monozygotic twins might not necessarily have these symptoms. So there's definitely a genetic component associated with IBS, but what these genes are, so far, we don't know. This diagram basically explains the 5 theories together. We've got a number of factors like environment, diet, lack of exercise, and genetics, which then stimulate GI motility, GI physiology with visceral hypersensitivity. We also know that stress in itself may stimulate the brain by the release of certain hormones, and this in itself may affect the brain gut axis. Now, by understanding this pathophysiology, by understanding this, we can then decide on what medications to use. And this is why we use anxiolytics. This is why we use antidiarrheas. This is why we use probiotics in our patients with IBS symptoms. But more about that later on. Important to note, there is a significant geographical variation. While IBS tends to be very common in the Mediterranean and in Europe and in the United States, it's much less common in South America, in Africa, and in Asia. Possible reasons are dietary changes. So what we eat in the Mediterranean, the typical Mediterranean diet, probably has a strong impact on IBS, but also genetics. Our genetics are different, and therefore this might explain the IBS variation that we see across the planet. It tends to be commoner in women. Possibly this is related to the female hormones. And the commonest stage group tends to be anything between 20 and 50 years of age. However, it can happen in children as well. And obviously, explaining to children what IBS is and convincing children to avoid certain foods is not easy. So in children, it tends to be more of a challenge, but the symptoms and the distribution tends to be similar in children as well, with more girls being affected than boys. Now, I put up this diagram just to show you how complex IBS can be. We can see most of the things that were mentioned, the theories related to stress, exercise, and diet, how important they are in the onset of symptoms. They tend to be the triggers of the symptoms of IBS. And in the middle, you can see all the different microbiota which have been associated with theories of IBS. Now, altering these microbiota is not easy, but we know that there are different bugs which are at play, and this is one of the main reasons why probiotics and prebiotics have been put forward as possible help in the management of IBS. Finally, this is a talk which has been sponsored by Energast. A few words about it, though Rachel will be talking in more depth on this new drug. It consists of sodium butyrate. It has a number of uses. It's not just used in IBS. It's also used in diverticular disease. It's also used in patients with chronic diarrhea or traveler's diarrhea. And what it does is it replenishes the levels of sodium butyrate in the gut. And this is a compound which is essential for healthy functioning of the gut. And we know that in IBS, the levels of sodium butyrate tend to be low. It's a longish course of treatment, usually a number of months, but I've had a lot of patients who did improve with this drug. And being a very safe drug with no side effects, a bit like probiotics, I tend to use it first line before I consider other drugs which might have a bit more side effects. But I'll leave you to Rachel to explain a bit more about this drug and about how to prescribe it. Thank you.
Thank you, Dr. Neville Azzopardi. A few quick notes on Energast. Energast has been shown to improve the quality of life in patients suffering from IBS. It improves the clinical symptoms of IBS, as shown in the bar graph on the right. The study duration was 12 weeks, and as you can see, after 3 months, there was a significant clinical improvement. Patients taking Energast also felt less abdominal pain and discomfort compared to placebo group. In the bar graph shown, you can see the results after 1 month, after 3 months of taking Energast, but also interestingly enough, after 2 months after end of treatment, which shows that patients continue benefiting from this treatment even after they stop it, which is a great advantage. Thank you for your attention.